Let's begin by understanding what allografts are. Allografts refer to the transfer of tissue between two individuals of the same species but with different genetic makeups. Unlike autografts, where tissue is taken from the same person, allografts avoid causing surgical trauma to another part of the patient's own body. This makes them a valuable alternative in medical procedures, especially when suitable tissue substitutes are needed. Allografts are widely used in various fields, including orthopedics and dentistry, due to their accessibility and effectiveness. In the following scenes, we'll explore the different types of bone allografts and their specific properties. Autografts involve transferring tissue from one part of a patient's body to another. While effective, this method comes with a drawback. It creates surgical trauma at the donor site. This means the patient has to heal in two places, which can increase discomfort and recovery time. Because of these challenges, medical professionals often look for alternatives that can provide the same benefits without the added trauma. Allografts offer a solution by using tissue from another person, reducing the need for additional surgery on the patient. This makes allografts an attractive option in many clinical situations. One of the major advantages of allografts is their commercial availability. Tissue banks play a crucial role in this process, providing a reliable source of bone grafts for medical use. These banks carefully screen, process, and store bone tissue, ensuring it is safe and ready for transplantation when needed. This commercial orientation means that patients and surgeons have access to suitable graft materials without the need for additional surgery on the patient. The convenience and safety provided by tissue banks have made allografts a standard option in many surgical procedures. Bone allografts come in different forms, each with unique properties and uses. The two main types are freeze-dried bone allografts and demineralized freeze-dried bone allografts. Each type is processed differently to enhance its effectiveness and safety for transplantation. Understanding the differences between these types helps surgeons choose the best option for each patient's needs. In the next scenes, we'll take a closer look at each type, exploring how they're made and what makes them special. Freeze-dried bone allograft is one of the most commonly used types of bone grafts. The freeze-drying process removes moisture from the bone tissue, making it easier to store and transport. This type of allograft is primarily osteoconductive, meaning it provides a scaffold for new bone to grow on. However, the results can vary depending on the patient and the surgical situation. On average, studies have shown that freeze-dried bone allografts can achieve about 50% bone fill in grafted areas. This makes them a reliable choice for many bone repair procedures. Osteoconduction is a key concept in bone grafting. It refers to the ability of a material to serve as a scaffold, allowing new bone cells to grow and fill in a defect. Freeze-dried bone allografts are excellent osteoconductive materials, providing the structure needed for bone regeneration. However, they do not actively stimulate new bone formation. Instead, they support the body's natural healing process. Understanding osteoconduction helps explain why freeze-dried bone allografts are effective in many clinical situations, even though results can vary. Demineralized freeze-dried bone allograft is another important type of bone graft. In this process, minerals are removed from the bone tissue, exposing the bone matrix and its proteins. One of the key proteins revealed is bone morphogenetic protein, or BMP, which plays a crucial role in bone formation. This type of allograft is not just a scaffold, it actively encourages new bone growth, making it osteoinductive. Demineralized freeze-dried allografts are especially useful in cases where bone regeneration needs an extra boost. Osteoinduction is the process by which a material stimulates new bone formation. Demineralized freeze-dried bone allografts contain proteins like osteogenin, which signal the body to produce new bone cells. This makes them more than just a scaffold. They actively participate in the healing process. Osteoinductive materials are especially valuable in challenging cases where natural bone growth needs extra support. By understanding osteoinduction, we can appreciate why demineralized allografts are so effective in promoting bone regeneration. Bone morphogenetic proteins, or BMPs, are a group of growth factors found in bone and cartilage. They play a critical role in bone healing and regeneration. When bone is demineralized, these proteins become exposed and can stimulate the formation of new bone tissue. One well-known BMP is osteogenin, which has been isolated from the extracellular matrix of human bones. The presence of BMPs in demineralized allografts is what gives them their powerful osteoinductive properties. Osteogenin is a specific type of bone morphogenetic protein that has been isolated from human bone. It is known for its ability to induce new bone formation, making it a valuable component in bone graft materials. When included in demineralized freeze-dried bone allografts, osteogenin helps to trigger the body's natural bone-building processes. This makes these allografts especially effective in cases where bone regeneration is needed quickly or in difficult environments. Tissue banks are specialized facilities that collect, process, and store human tissues for medical use. They follow strict protocols to ensure that allografts are safe and effective. The process begins with donor screening, followed by careful processing to remove any potential contaminants. The tissues are then preserved, often through freeze-drying, and stored until needed. This system ensures a steady supply of high-quality graft materials for surgeons and patients. Safety is a top priority when it comes to allografts. Tissue banks use advanced screening and sterilization techniques to minimize the risk of disease transmission. Each step, from donor selection to final packaging, is carefully monitored. This attention to detail ensures that allografts are not only effective but also safe for patients. As a result, allografts have become a trusted option in many surgical procedures. Allografts are used in a variety of clinical situations. They are commonly employed in bone repair, spinal fusion, dental implants, and reconstructive surgeries. Their versatility makes them suitable for both small and large defects. Surgeons choose allografts when they need a reliable, readily available material that can support or stimulate new bone growth. The choice of allograft type depends on the specific needs of the patient and the surgical procedure. Allografts offer several advantages over autografts and synthetic materials. They eliminate the need for a second surgical site, reducing patient discomfort and recovery time. Allografts are also widely available, thanks to tissue banks, and can be tailored to fit a variety of clinical needs. Their ability to support or stimulate bone growth makes them a valuable tool in modern medicine. Despite their many benefits, allografts do have some limitations. There is a small risk of immune reaction, as the tissue comes from another person. Additionally, the effectiveness of allografts can vary depending on the type and processing method. Some patients may experience slower healing or less bone fill compared to autografts. Understanding these limitations helps surgeons make informed decisions about when and how to use allografts. When tissue from another person is transplanted, the recipient's immune system may recognize it as foreign. This can trigger an immune response, which may affect the success of the graft. Modern processing techniques aim to reduce this risk by removing cells and proteins that could cause a reaction. While the risk is low, it's an important consideration in the use of allografts. The way allografts are processed has a big impact on their safety and effectiveness. Common methods include freeze-drying, demineralization, and sterilization. Each method is designed to preserve the beneficial properties of the bone while minimizing risks. Surgeons select the appropriate processing method based on the clinical situation and the desired outcome. Freeze-drying, or lyophilization, is a process that removes water from bone tissue by freezing it and then reducing the surrounding pressure. This allows the frozen water to sublimate directly from solid to gas. The result is a dry, stable graft that can be stored for long periods without losing its structure. Freeze-dried allografts are easy to handle and rehydrate quickly when needed for surgery. Demineralization involves removing the mineral content from bone tissue, usually with an acid solution. This process exposes the bone matrix and its proteins, including bone morphogenetic proteins. Demineralized bone is more flexible and has enhanced osteoinductive properties, making it ideal for stimulating new bone growth in challenging cases. Sterilization is a critical step in preparing allografts. Common methods include gamma irradiation, ethylene oxide gas, and autoclaving. Each technique is designed to eliminate bacteria, viruses, and other pathogens without damaging the bone's structure or proteins. Proper sterilization ensures that allografts are safe for transplantation. Once processed and sterilized, allografts are stored in specialized facilities. Freeze-dried allografts can be kept at room temperature, while other types may require refrigeration or freezing. Proper storage ensures that the grafts remain safe and effective until they are needed for surgery. Handling protocols are also in place to prevent contamination during transport and use. Before use, allografts are carefully prepared according to the surgical plan. This may involve rehydrating freeze-dried grafts or shaping the material to fit the defect. Surgeons follow strict protocols to ensure the graft is sterile and ready for implantation. Proper preparation is key to the success of the procedure. During surgery, the allograft is placed into the bone defect or area needing repair. The surgeon ensures that the graft fits securely and is in close contact with the patient's own bone. Over time, the body's natural healing processes will incorporate the graft, leading to new bone formation and restoration of function. The timeline for bone healing with allografts varies depending on the patient and the type of graft used. Freeze-dried allografts typically show bone fill within several months, while demineralized allografts may stimulate faster bone growth. Regular follow-up and imaging help monitor the healing process and ensure the graft is integrating properly. After implantation, the success of the allograft is monitored through clinical exams and imaging studies. X-rays and CT scans can show how well the graft is integrating with the patient's own bone. Any signs of complications, such as infection or rejection, are addressed promptly to ensure the best possible outcome. Like any medical procedure, the use of allografts carries some risks. Potential complications include infection, immune reaction, and graft failure. However, with proper screening, processing, and surgical technique, these risks are minimized. Surgeons are trained to recognize and manage complications to ensure patient safety. Not every patient is a candidate for allograft use. Surgeons consider factors such as overall health, the size and location of the defect, and the patient's immune status. Careful patient selection helps ensure the best possible outcomes and reduces the risk of complications. Before using an allograft, patients are informed about the benefits, risks, and alternatives. Informed consent is an important part of the process, ensuring that patients understand their options and can make educated decisions about their care. In some cases, alternatives to allografts may be considered. These include autografts, where tissue is taken from the patient's own body, and synthetic bone substitutes. Each option has its own advantages and limitations, and the choice depends on the specific clinical situation. Synthetic bone substitutes are man-made materials designed to mimic the properties of natural bone. They can be used when allografts or autografts are not available or suitable. These materials are often osteoconductive, providing a scaffold for new bone growth, but may lack the osteoinductive properties of demineralized allografts. When choosing a bone graft, surgeons compare the properties of allografts, autografts, and synthetic substitutes. Factors such as availability, risk of complications, and ability to stimulate bone growth are all considered. The goal is to select the material that offers the best chance for successful healing. Research is ongoing to improve the safety and effectiveness of allografts. Advances in tissue engineering, sterilization, and processing methods are making allografts even more reliable. The future may bring new types of grafts with enhanced properties, further expanding treatment options for patients. Tissue engineering combines biology, engineering, and materials science to create new tissues and organs. In the context of bone grafts, researchers are developing ways to enhance allografts with growth factors, cells, and scaffolds. These innovations could lead to faster healing and better outcomes for patients. Allografts are regulated by government agencies to ensure safety and quality. In many countries, organizations like the FDA set standards for tissue banks and processing methods. Regular inspections and strict guidelines help maintain high standards and protect patients. The use of human tissue in medicine raises important ethical questions. Tissue banks follow strict ethical guidelines for donor consent, privacy, and use of donated tissues. Transparency and respect for donors are essential to maintaining public trust in allograft programs. Most patients who receive allografts experience successful outcomes, with restored function and improved quality of life. The choice of graft type, surgical technique, and post-operative care all play a role in achieving the best results. Ongoing research and innovation continue to improve patient outcomes. Let's look at a case study involving bone repair with an allograft. A patient with a large bone defect received a freeze-dried bone allograft. Over several months, imaging showed gradual bone fill and integration with the patient's own bone. The patient regained normal function and experienced minimal complications, highlighting the effectiveness of allografts in clinical practice. In another example, a patient required a dental implant but lacked sufficient bone. A demineralized freeze-dried bone allograft was used to stimulate new bone growth. Within a few months, enough bone had formed to support the implant, demonstrating the osteoinductive power of demineralized allografts. Spinal fusion is another area where allografts are commonly used. In this case, a patient underwent spinal fusion surgery with a freeze-dried bone allograft. The graft provided a scaffold for new bone growth, leading to successful fusion and improved stability of the spine. Regular follow-up is essential after allograft implantation. Patients are monitored for signs of healing, complications, or graft failure. Early detection and intervention can address any issues and help ensure a successful outcome. Educating patients about allografts is an important part of the treatment process. Patients should understand what to expect before, during, and after surgery. Clear communication helps reduce anxiety and improves cooperation with post-operative care instructions. The surgical team plays a vital role in the success of allograft procedures. Surgeons, nurses, and support staff work together to ensure the graft is handled properly and the patient receives the best possible care. Teamwork and attention to detail are key to positive outcomes. After surgery, patients follow a specific care plan to support healing. This may include medications, physical therapy, and regular checkups. Adhering to the care plan helps ensure the graft integrates successfully and reduces the risk of complications. Long-term outcomes for patients receiving allografts are generally positive. Most patients experience restored function and improved quality of life. Continued research and innovation are making allografts even more effective, offering hope for patients with challenging bone defects. In summary, allografts are a valuable tool in modern medicine, offering effective solutions for bone repair and regeneration. With advances in processing, safety, and clinical application, allografts continue to improve patient outcomes. Understanding the different types of allografts and their properties helps surgeons make the best choices for their patients. As research progresses, the future of allografts looks even brighter.